Every day, 11,000 Americans turn 65. And for many of them, the biggest shock of aging isn't physical decline, it's Medicare. What's covered, what's not, what it costs, and how to avoid expensive mistakes can feel overwhelming, even for well-prepared retirees. Welcome to the Aging Well podcast, where we explore the science, stories, and strategies that help us live longer, healthier, and more purposeful lives. I am your host, Dr. Jeff Armstrong, an exercise physiologist with a passion for making science simple and life better as we age. Today, we're tackling one of the most critical and confusing topics of aging well, Medicare. Joining us is financial journalist Kimberly Lankford, a longtime contributor to AARP, and the author of the new book, Medicare 101. With more than 25 years of experience covering Medicare, healthcare, and personal finance, Kimberly has a unique gift for turning complexity into clarity. Today, she's going to help us decode Medicare so listeners can make confident, informed decisions about their healthcare and financial future to age well. Kimberly, welcome to the Aging Well podcast. I love the work that you've done. Can you tell us a little bit about your background, your work, and kind of how you came to kind of writing about the silver tsunami and Medicare?
Well, I've been writing about personal finances for more than 25 years. I wrote the Q&A column, they called it Ask Kim, at Kiplinger's Personal Finance magazine for about 20 years. Then I wrote about Medicare for AARP for about 3 years. And then now I'm at WSJ Buy-Side writing about insurance. And as I get older, I get so many more questions from my friends, family members about Medicare. And through the years, I've been writing a lot of different articles about them, and there's just so many misconceptions, and people don't realize even the very first step, that you need to take steps to sign up unless you're already enrolled in Social Security, which fewer and fewer people are by the time they're 65 these days. So I was really glad to get the opportunity to finally put all this information together in one book for people, and especially as so many more people are turning 65 every day, and even people in their 50s, like a lot of my friends who are helping their aging parents, suddenly have to take a crash course in Medicare and figure out what all of these things are and how to help their parents, even if they're not in their 60s yet.
Yeah, I think the hardest generation right now is probably the sandwich generation, the ones that are having to manage all of the financial aid for college kids as their kids hit college age, but then they're also having to deal with all of the aid that they have to apply for and manage for their older adults, or their older parents that they're caring for. So it's a tough time. And you open your work with highlighting this idea of the silver tsunami. Why is this demographic shift making Medicare literacy so much more urgent than ever?
Well, in the past, when Medicare was first created in the 60s, people were retiring at age 65. And it was just very simple. You retired, then you signed up for Social Security, and you got Medicare, and all of that happened just at a regular progression. And now things are so different. People are living longer, people are working longer. The full retirement age for Social Security is 67 now, rather than 65. Over the last several years, it's been gradually increasing. And so at age 65, you're still eligible for Medicare, but people don't realize it, and they don't realize that you need to take steps to sign up unless you're already enrolled in Social Security. So even just that first step means that it's much more complicated. Also, so many more people are still working at age 65, and that makes Medicare decisions more complicated. You might not need to sign up if you're working, especially for a large employer, and you have health insurance through that employer, but you need to make some decisions. Do you sign up for Medicare Part A, which is free for most people because they've paid for that through their Medicare taxes, from their payroll taxes through the years? Or do you sign up for Part B, which you have to pay premiums for. And if you're working and earning over a certain amount of income, you have to pay even higher premiums for that. So everything has just gotten a lot more complicated as people are living longer and working longer. And a lot of the ages, especially the age for Social Security benefits, has increased.
So you've been covering Medicare for more than 2 decades, you said. What do you think most people misunderstand about it?
I think the biggest thing is just how to sign up. And as as my friends are getting closer to be Medicare age, they're wondering, when do I sign up? What do I do? How do I do it? And it's not that complicated, but you just need to know the rules. I mean, the key thing is that there's a 7-month initial enrollment period that starts 3 months before you turn 65 and ends 3 months after you turn 65. And that's when you sign up. And if you don't sign up and you don't have insurance through an employer, you could get lifetime penalties. And people just don't realize that there's that much at stake. So, put that on the calendar if you're heading close to that direction, because that's really, really important. I think that's one of the key things. I mean, the steps for signing up aren't that hard. You can now sign up at the Social Security Administration website. They make it so much easier to do that. You could go to a Social Security office or call, but you can do, unless you have a complicated situation, you can sign up online, which is great. But it's just understanding those rules and where to go and what to do. And just understanding that, as you get towards that age, you need to start finding out if you're working, what your employer offers, if you should sign up for Part A and or Part B. And then also there's a lot of other decisions to make. You can get your Medicare from the traditional program, which is Part A and Part B, and it's a government program. You can use any doctor who participates in Medicare, which is most doctors, or you can sign up to get your coverage through a private plan called Medicare Advantage. And right now it's about 50-50. About half the people are in traditional Medicare, about half are in Medicare Advantage. That's another key decision that you need to make near the beginning, because it can be difficult to make changes later. So there's just a lot of important things that people need to think about as they're approaching that 65th birthday.
So this is probably an obvious answer to an easy question, I think, but your book is called Medicare 101. What motivated you to write this guide now?
Well, I think just putting everything together. And as more people are turning 65 all the time, and even more people are helping aging parents dealing with Medicare decisions, it's just good to have all of the information in one place. I had done a lot of articles about Medicare enrollment. I had done a lot of articles about making the most of Medicare, dealing with prior authorization denials, just all these little pieces of it, what you get free from Medicare, and being able to put it all together in one place, and hopefully a non-intimidating way, I really hope would help people, especially as they're reaching that age, helping their aging parents. Even if you've been on Medicare for several years, you need to make key decisions every year during open enrollment about your Part D prescription drug plan or your Medicare Advantage plan, if that's the way that you decided to go. And so even once you've signed up, there's just things you need to do every year to make sure you're making the most of this program, and that you don't have surprises, because surprises could be lifetime late enrollment penalties if you don't sign up when you need to. Or, for example, if you haven't checked all the Part D prescription drug plans available in your area and suddenly your drugs aren't covered, because that can change from year to year, you may have giant bills starting in January as the new plan takes effect. So just understanding how to enroll in the plan, first of all, and then how to make the most of the plan as you use it through the years, or as you're helping your aging parents use it through the years.
Yeah, we shouldn't be dealt that much stress as we get older. But is it getting more complicated for aging adults, or and this is probably a dumb question, is our government getting better and more efficient at doing it?
Well, there are a few things that make it easier, actually. So the Medicare Plan Finder at medicare.gov/ find a plan. It's the Medicare Plan Finder at medicare.gov. You can plans-compare. You can go every year during open enrollment, which is October 15th to December 7th every year, and you can compare all the Part D prescription drug plans available in your area. That tool is just fantastic, because then you can see everything that's there. You don't have to worry about missing anything. You can see if your drugs are going to be covered, and it's actually very personalized. You can type in your zip code, and then you can type in your prescription drugs, or go to your online Medicare account if you already have one, and and it will show you exactly what your out-of-pocket costs would be for the specific drugs you take. I think that is a huge tool that's really helpful that the government has keeps perfecting. They've had this for several years, but they keep working on it. You can also do that for Medicare Advantage plans, and it'll show you not only whether your drugs are covered, but how many out-of-pocket costs that you'll have for, the typical care that you might need, looking at premiums and both out-of-pocket costs, because those are key things. Both of those things are important in your calculation when picking the plans. So I think that's one of the things the government has done to make it easier. On the other hand, it has been getting more complicated as more plans offer Part D coverage. They don't necessarily cover every prescription drug. There's something called a formulary, which is the list of covered drugs. And Part D had a lot of improvements to coverage over the last several years. Some laws changed, and now, for example, in 2026, there's a $2,100 out-of-pocket spending cap on prescription drugs that are covered by Part D. The key thing is your drugs need to be covered by the plan, and not all plans cover all drugs. So even though some parts of this are very helpful, you need to make sure you're making the most of some of these new rules.
If you're enjoying the Aging Well podcast, be sure to like, subscribe, or follow on your favorite platform so you will never miss an episode. And if you find our conversations helpful, please share the podcast with a friend, because aging is something we're all doing, and we're better at doing it together. And support our guests in this podcast financially by visiting the affiliate links in the episode description below, and use the links or codes provided for discounts on products we have vetted and feel comfortable recommending to our valued viewers and listeners. Thank you, and now back to the podcast. So this is where I think AI can benefit a little bit in terms of being able to go onto these websites and the computer doing some thinking for you to be able to tell you what to do.
And that's what, I know employers for employer health plans have been using AI a lot in order to help people pick the best plans for them. And, open enrollment just ended for, the plan year in December. And so people are starting to use their plans now. But who knows, next year, there may be even more developments in the plan finder to help people and help people figure out, what's the best plan for them. Because like I said, you don't want to just look at premiums. In the past, some people might have said, oh, well, this is the lowest premium plan. But if it has high out-of-pocket costs for your drugs, or if it doesn't cover your drugs, that might not be the best plan for you. And especially if you are in Medicare Advantage, you need to think about, what are my regular medical expenses that I have? You never know exactly what's going to happen to your health during the year too. So also look at some of those, out-of-pocket spending caps. How much can you spend during the year for the plan? Are the hospitals and doctors that you want to go to covered? What happens if you want to go out of network? So many little questions. And I think AI could help people with some of those issues.
It seems like where it's complicated is actually probably a benefit to the population, because now you have so much more flexibility, because I've always kind of thought of Medicare as just, you sign up for Medicare and it's kind of a flat thing across for everybody, but it's really not. It really depends on your own personal circumstances, needs, income, and all those kind of things. So
that's right. And that's another thing where it's changed since the 60s when it was first introduced. I mean, they had original Medicare then, which was Part A and Part B. Most all doctors were covered, and some people had either retiree plans that might have helped, fill in some of the gaps, some of the co-payments and deductibles you had to pay yourself, or there are Medicare Medigap plans, Medicare supplement plans that can help fill in some of those gaps. But now that there's prescription drug coverage, it's great because, in the past when it was first introduced, there wasn't prescription drug coverage. Now you also have the choice of Medicare Advantage versus original Medicare. Like you said, so many more choices, which can be very helpful, but also can be intimidating.
Right. So for our viewers and listeners who feel overwhelmed, how do you recommend they think about Medicare at a high level before diving into the details?
I think go to the Medicare.gov website. Take a look at the book, which
obviously,
can also give you a good guidance. I think the good thing about Medicare 101 is I was able to include chapters for everything. There's the enrollment section. There's the dealing with Medicare and administrative things section. There's the making the most of your Medicare coverage section. But also go to Medicare.gov website, because it really is they do make it very clear for people. Talk to your employer if you're still working. That's very important. important, because if you're working for a company that has 20 or more employees, and they provide health insurance for you, you may not have to sign up for Medicare at 65, but you need to decide what you want to do. Do you want to sign up for Part A, which a lot of people choose to do because they don't have to pay premiums for it? That's what their taxes had been paying for through the years. And then figure out whether or not you want to sign up for Part B. If you're working for a small employer, fewer than 20 employees, you usually have to sign up for Part B because your employer's coverage becomes secondary to Medicare. And if you don't sign up for Medicare, then you could have coverage gaps. If you're retired, you generally have to sign up for Part A and Part B at 65, or else you may get that late enrollment penalty. But if you're still working, talk with your employer plenty of time in advance, because they can give you ideas of what's covered, what's not, what's going to be primary and secondary, what your expenses are going to be. And that's just a really great thing to do as you're approaching age 65.
Now, you tongue-in-cheek said, buy the book. I would wholeheartedly underscore that because, reading through the book, it is so well written. It's written at a level of language that I think anybody can understand, and it is written in small little chunks that it's really just kind of informative. You don't have to read every page to get to the information you need. You can easily flip through it, find out, okay, do I want A? Do I want B? And you go on Part C and D and all these, a whole alphabet soup of different parts to Medicare. But the book is so well written for anybody to be able to manage it, to get the information they need. So congratulations to you on writing such a good book for, anybody who just needs that information and wants it as a great little resource.
Oh, thank you. Well, I wanted to try to make it a little less intimidating, because it is so intimidating for people. And like I said, Medicare.gov website's helpful, but there's all these little pieces to it, and to know where to go can be complicated. And so hopefully this can help people, focus on the enrollment section when they need that, focus on administration and dealing with prior authorization and denied claims, things like that. And then, figuring out what kind of coverage you have, what's covered and what's not. I mean, a lot of people don't realize there's a lot of preventive care that's covered free without any deductibles or co-payments. We have sections about that. There's a lot of also help for caregivers. There's nutrition therapy. There's a lot of things that people don't realize are covered by Medicare. And if you understand some of those issues, you can even get more out of Medicare than you realized.
So can you walk us through some of the basic differences between Parts A, B, C, and D, and in a way that really helps people kind of make those decisions without giving away all the books so that they don't have to read it?
So there's still plenty to cover. Right. But Part A is your hospitalization. And like I said, most people don't pay premiums for Part A because they've been paying for that through their Medicare taxes, through their employer or self-employment through the years. Part A, every year or every benefit period, there's a deductible that you may have to pay out of your pocket first. And then depending on how many days you're in the hospital, you might also have some co-payments to pay. So with that, a lot of people, fill in those gaps either by getting a Medigap plan, also called Medicare Supplement, or they may have retiree coverage if they're lucky from a former employer that can fill in some of those gaps and pay for some of those deductibles and co-payments. Part B is very simple. Part B covers doctor services and outpatient costs, and it covers 80% of those costs, of the Medicare approved costs, and you pay 20%. And so that's the other place where a Medicare supplement policy or retiree coverage can help fill in those gaps. Now, Part C is Medicare Advantage. And Medicare Advantage is that other route that you could go. Medicare Advantage is offered by private insurance companies, and it has the same coverage as Medicare, essentially, but you may have different out-of-pocket costs. So instead of that 20% copayment for Part B, you may have to pay, $20 or $40 for doctor's visits, or maybe $80 for, diagnostic tests. So you just really need to look at what those out-of-pocket costs are. The big difference between Part C and original Medicare is that not all doctors are included in the plan. Medicare Advantage plans cover in-network doctors, and they might provide very good coverage for that, but they may not cover may not provide any coverage for out-of-network doctors. And some plans, PPOs, more like what people are used to from their employer, might have different copayments and different deductibles for in-network versus out-of-network. So really, really important if you're picking a Medicare Advantage plan to understand what those limitations to the doctors could be, whether the doctors you like in your area are covered by those plans, and also check it from year to year, because the doctors in the hospitals that are covered can change. Part D is prescription drug coverage, and that was introduced, many years ago, actually about 20 years ago, and that's been able to provide prescription drug coverage for the drugs covered by the plan, which is called a formulary, and which has been just a godsend to many people with expensive prescription drugs. That plan has really improved a lot over the last several years. Now there is an out-of-pocket maximum. This year it's $2,100 that you have to pay for the prescription drugs yourself if they're covered under the plan, and that saved many people thousands and thousands of dollars. But like I said before, it's really important to make sure that your drugs are covered, because if your drugs aren't covered, it's not subject to that cap. You could still pay an extraordinary amount for those drugs. So those are the 4 key parts of Medicare, and you need to figure out kind of how to piece them all together when you're creating your own plan. And that's what gets really complicated.
And I would think, too, it gets a little bit more complicated because you almost have to anticipate what you might need as opposed to what you absolutely need. It's like, I'm getting older, there's a greater likelihood that I'm going to maybe need certain drugs, given my medical history and things like that. I mean, I'm hopeful that I don't need any medications as I get older, but, as you get closer, there Alzheimer's medication or something like that is something we don't necessarily anticipate, but maybe you see yourself kind of going down that path. You got to be prepared for that.
And the good thing is there's open enrollment every year for Part D and Medicare Advantage plans. So every year you can reassess the situation and say, oh, is this still the best plan for me? And so that's where using the Plan Finder can be really helpful to check out your drugs. And if your doctor has talked about, we may need to put you on some new drugs this year, look and see if those drugs are covered. Sometimes in the middle of the year, you get prescribed a medication that isn't covered, and you need to figure out what to do for a few months until you can switch plans. But that's one of the really good things, is that you can switch plans every year if you need to really pinpoint what your health is like that particular year.
And if you feel like you're spending too much, you can always pare back a little bit, and you can think things through every year, which I think is a great opportunity.
And it's also important if you're helping your aging parents. I know I had to start helping my parents pick their Part D plan over the last few years. And it was the first time I had to do it myself. And, just keep an eye out, because, your parents, if they are starting to need some more help, in the fall, it's October 15th through December 7th. That's the time to pick the Part D and Medicare Advantage plan for the upcoming year. So, if they need some extra help, it might be a good time to work with them. Another key thing is the state health insurance assistance programs. They call them SHIPs. They are really, really great resources, and they can help you out during open enrollment as well. And they can help out your parents too. And if you go to a website called shiphelp.org, that's where you can find them. Every state has them, and they provide free help for all kinds of Medicare issues.
Yeah, I know some states are probably better than others. I know here in Oregon, they're really, really good with, getting people connected with Medicare and the other advantages that they have from kind of government supplemented kind of medical insurance and such. So
they're a great resource.
Know what state you're in and know your resources. So Medigap is especially confusing for many retirees. What role does it play, and who truly needs it?
So Medigap, if you have traditional Medicare, instead of signing up for a Medicare Advantage plan, that's where you might have those deductibles and copayments, like the 20% copayment, coinsurance rate that you have for Part B. So when you go to the doctor, generally Medicare will pay 80% of those costs, and you'll pay 20%. So Medigap can fill in those gaps. Medigap can cover the deductible, can cover the Part B deductible is small, but the Part A deductible is over $1,000. And that's for every benefit period. So it's pretty much every group of hospital stays that you might have per year. Usually it's, one per year, but depending on if you've had to be in the hospital more often and had 60 days out of the hospital, you might have more than one benefit period per year. Anyway, these are just, out-of-pocket expenses that can be hundreds and even more than $1,000, depending on what the deductibles and co-payments are. And so Medigap can cover those costs. And Medigap is offered by private insurance companies, and you can get it pretty much any time, technically. However, if you don't get it at certain times, you may be charged more or rejected for coverage because of pre-existing conditions, which is not the case in almost every other kind of health insurance these days. And so this really makes a lot at stake when you're deciding whether or not you want to get Medigap. The key thing is that you can get it, any Medigap plan available in your area, regardless of your health, for the first 6 months after you first sign up for Part B. So you really, in that timeline of thinking about what you're doing as you're approaching 65, also think about, okay, if I'm going to be signing up for Part B, if I'm not working or if I work for a small company, do I also want to sign up for Medigap then? And this also makes the decision between Medicare Advantage and original Medicare very, very important decision, because if you decide to sign up for Medicare Advantage when you first enroll in Medicare and then change your mind later on and want to go back to traditional Medicare, you can do that, and that's not a problem. But you might have a difficult time getting a Medigap plan unless you qualify for a special enrollment period or a guaranteed issue period. So, if it's more than 6 months after you first signed up for Part B and you change your mind and want to get a Medigap plan later, in most states, you could be rejected or charged more. So this is where the ships can be really helpful, because these state rules can vary a lot for Medigap plans from state to state. A few states like New York and Massachusetts, you can sign up pretty much any time for Medigap, but the rest of the plans, pre-existing conditions might make it more difficult. And as you get older, more and more people have pre-existing conditions. So that's another thing that's just a really, really important decision to make up front.
It can be complicated, and we all want to live until we're 120, right? Like Brian Johnson. So we better be healthy in that process and make these decisions right every year. So what are some of the most common and probably costly mistakes people make when enrolling in Medicare?
Well, I think the first one is just the very first decision is when to sign up. And like I mentioned before, if you don't sign up during that initial enrollment period, the 3 months before you turn 65 up through 3 months after, and you aren't working and don't have other coverage, then you could end up having to pay a late enrollment penalty for Part B for the rest of your life. And that just makes a lot at stake. Also, Part D, the prescription drug coverage. If you have other prescription drug coverage through an employer, through a retiree plan, through TRICARE, if you were in the military, then you don't have to sign up for Medicare Part D. But if you don't have other coverage, which they call creditable coverage, which means it's coverage that's similar to Part D, at least as good as that, then you could end up having to pay a Part D penalty for the rest of your life, for as long as you have Part D, if you don't sign up within a certain time period. So I think the very first biggest mistakes people make are just those enrollment mistakes that have so much at stake. And then another big mistake kind of ties back to what we just talked about with the Medigap plans. If you don't make those decisions at the right time, it could be very difficult to get a plan, a Medigap plan later on. So you just need to really understand all these time frames and what's at stake, and be prepared to make those decisions. Just do some research ahead of time and spend some time making those decisions so you don't end up having surprises later on.
So it sounds like don't wait until you're 65 to consider Medicare. Start probably early. I'm 62. I'm coming up on 63. I probably should start planning.
It's a good time to start doing some of the research, and just at the very least, start thinking about do I want to sign up for Part B? Do I want to sign up for Part A if I'm still working? What do you want to do? And then also start thinking about that concept of traditional Medicare versus Medicare Advantage. I mean, the Medicare Advantage options vary so much depending on your area. Some parts of the country, like California, there's a lot of Medicare Advantage Advantage plans. Some people are very happy with their Medicare Advantage plans, and a lot of doctors are covered. Some other areas may just have one or two Medicare Advantage plans. Some of the major teaching hospitals in those areas may not be covered by the plans. So just start getting an idea for what's covered by some of the different options in your area, and that can help you make some of those decisions.
Let's pause for a moment to thank the affiliate partners who help support the Aging Well podcast. We're not sponsored and no company pays for airtime here. But when you use our affiliate links, it helps us keep producing thoughtful, evidence-informed content. One brand I genuinely trust is Aura Wellness, especially their Glutarol, Glutarol Plus, and copper peptide formulations. I've spent time vetting their science, their ingredient quality, and their transparency, and I personally use these products in my own wellness routine. If you're interested in supporting the podcast and exploring tools that may help you feel and function better, check out Aura Wellness in the show notes. So you mentioned the penalty for not enrolling in time. So if I don't enroll at 65, I get a penalty that is going to persist for the rest of my life?
That's right. Well, if you didn't have employer coverage, if you didn't have other coverage, and there's a few other exceptions, but if you don't sign up when you need to, then yes, you will have to pay a Part B penalty for the rest of your life, and it's based on a percentage of the Part B costs every year, so it actually goes up every year too. There's been a few additional places where they have helped people avoid the penalty. One of the newer ones was, if you were given inaccurate information from an employer, you might be able to try to avoid having that penalty. But otherwise, you have the penalty. Another big mistake that people make too is they don't realize that if you are still working and, or even if you're just, taking taxable withdrawals from retirement plans, if your income is above a certain level, your Part B premiums are going to be higher that year. Every year it's called the income, it's called the IRMA, and it's a high income penalty. And every year it's reassessed based on your income. And if you earn more than $109,000, if you're single, or $218 if you're married filing jointly this year, you might have to pay the penalty. Now, the key thing with that is it's a surcharge. It's not a penalty, but it's reassessed each year. And the key thing is it's based on your income 2 years prior. So the 2026 premiums are based on your 2024 income. People don't realize, though, that if you retired since that time, if you retired in 2025, for example, you can actually fill out a form with the Social Security Administration, because they handle a lot of the administration for Medicare. And you can get that penalty. You can have your premiums based on your income, more recent income, your post-retirement income, rather than your 2024 income, and have that penalty reduced or eliminated, have the surcharge reduced or eliminated. So a lot of people don't realize that. But, for example, if you were taking a lot of money, taxable withdrawals from an IRA, or if you sold a house and had a big taxable gain, above what your exclusion was, or sold a lot of stocks, other reasons like that don't count to get the penalty reduced. It's only things like retirement, death of a spouse, divorce, certain life-changing events that let you qualify. But be sure, if you have retired during that time, it's SSA 40. Yes, SSA 44 is the form, and take a look at that, because you might not have to pay as much extra as you thought you would have.
This is starting to frighten me a little bit as I get closer to 65. But so if we choose the wrong plan, that's not going to necessarily, or it's going to impact our finances, but also the potential for stress levels and overall well-being as we age. So how do people deal with that? I mean, what are our concerns about the stress level that it might cause us?
I think this is where it's just, do your research, like you had mentioned, as you're, approaching 63, it's a good time to just start doing some research into it. I mean, it's not, if you do the research into it, then you can feel confident that you're making the right decision. And the good thing is that, Medicare still provides a lot of coverage for people. It makes a huge difference in their finances, and especially for people who might not be working in their early 60s and had to get a plan on the marketplace on their own. So many of those people have experienced big premium increases over the past year. And so when you do turn 65, it can be a big relief. And there's just a few key decisions that it's really important to do research into ahead of time, and then you'll feel comfortable that you've made the right choice. And like I said, for Part D, Medicare Advantage, you can reassess that every year, which is good. The other good thing is if you're happy with your plan, you don't have to do anything every year. As long as your plan still exists, it can roll over straight into the plan the next year. My parents' plan, I did the research, saw that their drugs were still covered, didn't have to do anything during open enrollment for them this year. But I'd say doing a little bit of research and it can make you feel a lot more comfortable, not intimidated, but just more comfortable that you're making those 3 or 4 real essential decisions in the best way when you have the option to do it.
So that gives a little bit of comfort to people who might have a more steady lifestyle or things going into retirement, that they don't have to do this every year. It's not something, oh my God, it's like, I just did taxes April 15th. Now it's October 15th and I got to do my Medicare stuff. As long as we, again, just kind of keeping on top of things, we can not have to necessarily be changing our plan every year or reevaluating every year. It might just be maybe every 5, maybe even 10 years, you might have to make a change.
And I'd say, go to the plan finder at Medicare.gov, and right on the top of the Medicare.gov website, they have a link to that every year during an open enrollment. And I'd say just, go in there every year and type in your zip code, type in your drugs. If you have a Medicare, online Medicare account, it actually you just log into the account and it'll just show you the costs under each plan. I'd say just do that quick thing every year. And then you'll find out, are there any big changes? Is there any big surprises that, that aren't going to be covered? And then you'll feel confident that you haven't missed out on anything. So I think it's really good that you have an opportunity every year to be able to make the changes. But it's also really good that you might not have to actually do anything.
Right.
Just after you do that quick look and make sure, everything still looks okay, then you can just keep going as is.
And I would imagine, though, too, that some people might find, wow, I make this change, it's going to save me a few $100s, a few $1,000s a year. So being aware of that can help save us money, as well as, not necessarily causing us stress, but kind of, giving us a little bit of comfort, right, by taking a little bit of intention with it.
You can feel good. And in fact, new plans enter areas, pretty often. Sometimes plans will leave, but sometimes, and they're very competitive. Some of them might be competing for more people to join their plans. And so you might find some plans, Part D, generally most of the plans had increased premiums a bit over the past year. But you might find different coverage for your drugs, and also, the plan finder is also great because it shows you whether there's generic alternatives. Maybe you just didn't know and you're able to save a lot of money on that. For Medicare Advantage, there's a lot of plans coming and going. A lot of them are charging 0 premiums in addition to your Part B premium, which everyone pays. And you can really take a look at, what they're covering and how they're covering it. I mean, the key thing with Medicare Advantage is don't just shop based on premium, because you will have some out-of-pocket costs that you might not have had if you had a traditional Medicare plus a Medigap plan. But look at what those coverages are. With Medicare Advantage plans, you might also have some dental, vision, gym membership, a lot of, little pieces of coverage that you might not have through original Medicare, but look carefully at them. A lot of the dental plans have dollar limits that may be lower that you might not have realized. So, when you're looking at those things that are covered, and a lot of those plans are really competing, based on some of those additional coverages, delve down into that and see what's covered and compare that to what your regular expenses are during the year, see how much you can save. So yeah, like you said, sometimes you can find some new strategies that can really save you some money. Also might be able to find some additional coverages that you didn't realize you had.
Or if you see something is going to be going up, you maybe have push that care up a little bit closer. It's, I know with like dental care, a lot of times, people can load up on the dental care before there's going to be an increase on their benefits.
Well, and that is
I
a
guess
great
the cost of the
strategy too.
benefits.
I was at the eye doctor in December, and it was packed with people who were there using their benefits for the year. But that's a great strategy too, because and that's where it's really good that open enrollment. It's in the fall, so you still do have a few months to use that plan that you currently have. So yeah, if it is something some dental procedure or some other procedure, and maybe you've already paid the deductibles, or maybe you've already gone up to a certain level of coverage, or for prescription drugs, maybe you've already reached that $2,100 maximum. Try to make the most of 1 year versus the other year, because you do have those last few months of the year kind of where you have an idea what the coverage changes are going to be for the following year.
So for individuals who are living on a fixed income, how can they realistically plan for healthcare costs under Medicare?
Well, if you don't have much money, you may qualify for some special help. And there's Medicare savings programs that can help with the premiums and the co-payments for Medicare, for traditional Medicare. And there's something called extra help, which can help with your out-of-pocket costs for Part D prescription drugs. So if you have low income, income below certain levels, take a look at the Medicare.gov website, because those qualifying numbers change every year. Also, you can contact your SHIP and find out if you qualify for some of these programs. Also with prescription drugs, there's lots of other strategies too. There's, pharmaceutical assistance programs, both from the states and from some of the pharmaceutical companies. There are, other programs, other benefits programs that might be available in your state where you can get, maybe transportation to doctor's appointments and, just some other things that can help you with some of your expenses. So, this is where, if you think you might qualify for some of these things, call your SHIP, call your state health insurance assistance program, and kind of lay out your income levels and some of the things that you need help with, and they can help you find out not just about some of these Medicare savings programs or extra help, but also some of the programs in your area, because so many states are starting to offer more programs as well.
So you've touched on caregivers a little bit. What advice do you have for adult children who are helping their parents navigate these Medicare decisions?
I'd say, first of all, as your parents are just starting to need more help with their finances, this is one of the key things to think about. And, I had to start doing this to help my parents over the last few years. Maybe they don't need a lot of help, but maybe they just need help navigating at open enrollment, their choices. So it might be a good idea to say, hey, let's just go on the computer and together and tell me what your medications are, and let's see what it's going to cost the next year. That was really helpful, in my situation with my parents. Also, just, take a look, go to Medicare.gov. Also, there's a Medicare and You handbook that everyone who's on Medicare gets every year from the Centers for Medicare and Medicaid Services. And it outlines some of the coverage, the costs, some of the changes from year to year. You can find that handbook online at the Medicare.gov website, and that's just a really great introduction to Medicare, especially if you're younger, if you're helping your aging parents. Just take a look at that and just get an idea for, okay, what's covered, what's not, what do I need to do? I think it's just a good idea, as you're starting to help your parents with their finances, helping with Medicare is just one of those steps that you may want to keep an eye on as well.
So we've already kind of touched on the fact that I need to start looking at these things as going on 63.
Perfect timing for you.
Yeah. So, how early should someone really realistically begin preparing for Medicare, and what should that preparation look like?
I think right around age 63 is a really good idea. The first time that you can actually take the steps to enroll is 3 months before the month you turn 65. So you can't actually enroll until then. But especially if you're working, this is a really good time to talk to your HR department and find out, what coverage do I have? What coverage, should I sign up for with Medicare? How do the two coverages coordinate? I think that's one of the more complicated issues, is making some of these decisions if you have employer coverage. Some people who are working for a large employer and don't have to sign up for Medicare, they may, a lot of times they'll sign up for Part A just because it's free. But if you're contributing to a health savings account and you want to keep contributing to that, you can't do that after you sign up for Medicare. So some people who are working need to make that decision as well. Do they want to, not sign up for either Part A or Part B and continue to contribute to their HSA and then later on sign up for both? If you do delay signing up because you're working, you really need to keep an eye out on the time frame after you leave your job. You then have 8 months after you leave your job generally to sign up for Medicare without facing any of those late enrollment penalties. But I think that's some of the key things. And then, maybe the next fall, take a look at, go to the Medicare Plan Finder at Medicare.gov and take a look at what some of those Part D and Medicare Advantage plans are in your area. I mean, the specifics that are available will be different by the time you actually turn 65, depending on, what time of year that is. But just get an idea, are there many Medicare Advantage plans in my area? Do I want to have coverage for any doctor at all? Or do I maybe want to pay lower premiums and have and have a limited provider network? What do those provider networks look like? That's some of the research you can start to do ahead of time, even though the final answers won't be there until you actually sign up. But that can just make you feel more comfortable in some of the decisions.
Yeah, you mentioned, so you have 8 months after you've lost employment to be able to register. Now, does that still fall within the October 15th to, December 15th deadline?
Yeah, no, that is just whenever you leave your job. And it's whenever you leave your job or lose the employer coverage, health care coverage, whichever comes first. And a key thing, this is that trips people up a lot. A lot of times, when you leave a job, you can continue your health insurance coverage from your former employer through a plan called COBRA. And it's a federal law that lets you continue your health insurance, your employer health insurance for a short period of time afterwards. That doesn't count as an employer coverage for Medicare. So even if you do keep your old coverage through COBRA, you really still have that time frame where you have to sign up for Medicare. So, when you do leave your job, if you had delayed, and even if you had just delayed signing up for Part B, make sure to, understand about that 8-month time period. And yeah, that won't necessarily coincide with open enrollment. You'll still be able to, October 15th to December 7th can still pick your, Part D and Medicare Advantage plans, but you also get this, it's called a special enrollment period after you leave your job to be able to sign up for that additional coverage when you do sign up for Part A or Part B.
So that gives a little bit of comfort to somebody who maybe is in a bit more of a vulnerable occupation where they unexpectedly lose their job around the time of turning 65, and maybe they weren't prepared to lose their job, but now they have that little bit of a cushion to be able to get enrolled without having the penalties that might come along with that.
And, that's the great thing about Medicare. It really just opens a lot of doors for people once they do turn 65. I know so many people in their early 60s are just really worried about retiring early. What are they going to do about health insurance? Some people want to start a business but know that buying their own health insurance is getting even more expensive. But once you turn 65, you have Medicare coverage. Even though it's not free, you still have out-of-pocket costs and some premiums. It's so much less than many people are paying, especially if they don't have employer coverage and are paying the full cost on their own. I wrote about this in the book that, getting on Medicare is very, freedom for a lot of these people. It gives them a choice to, move to a different part of the country, maybe start their own business, maybe retire at that point and not have to worry about health insurance anymore.
Let's take a brief pause to recognize one of the affiliate offerings that helps support the Aging Well podcast. As always, we're not sponsored and we don't accept paid placements. But when you use our affiliate links, it helps us continue producing this show. One product I genuinely enjoy is Firefly Organic Coffee, available through Jigsaw Health. It's thoughtfully sourced, organic, and crafted for people who care about what goes into their bodies, not just what wakes them up. I vetted it, I drink it myself, and I appreciate the care behind how it's made. If you'd like to support the podcast and check out Firefly Organic Coffee, you'll find the link in the show notes. Now, back to the show. What about people like myself who started having children late in life? My daughter was 42 when she was born. No, older than that, because she's going to be 18 when I turn 63. So, or right after I turned 63. So I got a couple years before I'm eligible for Medicare, which is not a problem. I hope to keep teaching. But what about that point when I now turn 65? She's still going to be kind of eligible to be under my medical care. How does that impact individuals who are under Medicare but maybe have children who are eligible to be under their medical insurance?
That is such a great question. And that's another thing that trips people up a lot, not just for children, but for younger spouses as well. Medicare is not a family plan. And so when you go on Medicare, it's just you. And just
Right.
because you're eligible doesn't mean that they're eligible. And so it really is important, if you are still working, to figure out, can they keep, if you go on Medicare, if you drop your employer coverage, can they keep the employer coverage through COBRA? That the same law that lets people keep it after they keep their employer coverage after they leave their job also lets some family members actually for a bit longer keep the coverage that the family member had been providing for them. But whenever you go on COBRA, the premiums jump a lot. So that's another key thing to keep in mind when you're making the decision about, do I want to drop employer coverage if I'm still working? Do I want to just stay on that so the family has all of the coverage and has a part of the share of the cost paid by the employer? That's really, really a great question. And, anyone with a younger spouse, even if it's just somebody who's, 2 or 3 years younger, if you're the, spouse that's work is providing the health insurance, really think about what their options are. Another key thing to talk with your employer about, the HR department about, what could happen to your family's coverage, because they won't be able to go on Medicare when you do.
Yeah, my wife's a year younger than me, and she'll probably retire before I do. So we got some things to think about. But also, I guess with a college age child, they can also get certain coverages through their universities and things like that. If they don't need really serious, expensive, they might just need basic healthcare costs covered. They can be covered, right?
Yeah, they have a lot of options. A lot of universities have a health plan. Depending on the other options, they might be able to get marketplace coverage through the state marketplace. And if they have low income, if they're on their own, it depends on if they're on their own or not. But if they're on their own and have low income, they may still be able to qualify for a subsidy. The subsidies still exist. It's just they're a lot smaller than they had been last year under the current rules. And who knows what will change. But there's a lot of different options for them. But that's just another factor. And that last, year and a half before you turn 65, those are some other key things to think about.
Yeah, you don't want to wait until the last minute to make these decisions.
Exactly. And I'm just so glad you brought up about the family members, because a lot of people don't think about that and don't think about what's going to happen to their coverage. So just another key thing to add to that list of things to think about in the last year or two before Medicare.
So it can cause stress if you don't prepare for it. But if you prepare for it and you start thinking early, it should be relatively stress-free.
Yeah. And then once you're on it, should make a lot less stress. The good thing about if you're on traditional Medicare, every doctor who is, covered in the Medicare program, which is almost all doctors, will be covered. And that's very simple. So, so many people who might have had an HMO or a PPO at their employer, if you decide to go on traditional Medicare and then get a Medigap plan, you might have, Medigap plans have separate premiums, but then a lot of the plans you'll have no out-of-pocket costs other than the Part B premium, which is just $283 in 2026, and then that's it. It's very, very simple. And if you go on Medicare Advantage, you'll have generally lower premiums, but provider networks. But some of these things, once you're on it, can make things very, very simple. And especially with if you have traditional Medicare and a Medigap, you will be paying higher premiums than you would for Medicare Advantage, but you'll have very few out-of-pocket costs during the year, which is relieving to a lot of people.
So what resources or strategies do you recommend for comparing plans without becoming overwhelmed? You talked about going on the site and actually using the site. Is there anything else other than the book? Got the book right here.
Look, thank you. I'd say, yeah, the book is just great to give you an idea about all the decisions that you'll have to make. And then go to Medicare.gov. And, as long as you're fine using the computer or helping your parents use the computer, that really can let you know really about in your area. Because, the Part D and Medicare Advantage plans are very different from area to area. And so you have very different options. Medigap plans they're regulated by the states. And so if you go to the state health insurance department website, you can find out a lot more about what those rules are. Because, there are a few states, like I mentioned, like New York and Massachusetts, where you don't have to worry about pre-existing conditions for Medigap if you want to change plans after that first 6-month, guaranteed issue period. Also the SHIPs, like as I mentioned before, they're really great. And it does vary from state to state. But some states, they're very active, and you can call them, you can ask them questions. You can also, a lot of times during open enrollment, they'll have seminars that they go to senior centers and, retirement communities, and it's free, and they help people make Medicare decisions. And I think that that's just a really relieving way to get help, because a lot of times it's one-on-one help. There's someone there who's done a lot of training, and, wants to figure out what you can do, and really knows the very localized, plan options, state rules that can help you out. So I'd say those are 3 of the really great resources.
So after reading Medicare 101, what do you hope readers will feel differently about Medicare and about aging itself?
Well, I hope, first of all, that it will help them be a little less intimidated. I mean, some people aren't intimidated because they don't know what all this entails signing up. So hopefully informed yet not intimidated, I guess, is the key thing. And hopefully we'll just, like you said, it's broken up into bite-sized pieces. So, as you're approaching enrollment, just look at that section and see, what are these decisions I need to make? What kind of research can I do ahead of time so I'm not, as intimidated by the process. And then as you're starting to use Medicare, what are some of the things I can really make the most out of Medicare? I mean, there's some resources to help caregivers. There's a lot of preventive care that people don't realize about. Also just knowing, about being able to fight a claims denial. There's prior authorization is a big issue with Medicare Advantage plans. Not as much original Medicare, although there's some pilot projects right now that is expanding prior authorization in a few states for a few specific types of care. But Medicare Advantage, a lot of times, your doctor will have to get permission to do a procedure, even though your doctor says that it's necessary. And Kaiser Family Foundation, KFF, just came out with a study. They had an earlier one that found out that, so many Medicare Advantage plans have prior authorization requirements, and only a certain percentage, only 11.5% of the prior authorization denials were appealed. But the people who went through the appeal process, more than 80% got their appeals, got the denial overturned. So there's just hope to know that, even if you have Medicare Advantage and you might be frustrated that you can't get some of the care that you need, go through that appeal process. Talk to your doctor. I've done articles where I've talked with doctors that, frequently have to help people with these prior authorization appeals, and they're very familiar with it. So talk to them, find out what they can do to help you out. There's, a step-by-step procedure, and, don't necessarily take no for an answer. So things like that, you'll find out more about that in the book, just to know that, these are ways that you can really help make the most of Medicare. And if you have any troubles, there's a lot of resources to help you out.
And I think it's something we need to learn much earlier in life, is just to be a good advocate for ourselves in the healthcare system, and not wait until you're on Medicare to kind of, strap on your advocate hat and advocate for yourself. Do it throughout, but realize that you can advocate. You're not kind of just subject to this daunting system.
I know it is amazing to see with the Medicare Advantage denials how many were overturned, and just take those steps. And yeah, when I've done articles about this in the past about people who have gone through denials and they've succeeded in having it overturned, some of them gather information themselves and they try to present a strong case. But their doctor is just really a great advocate too. And a lot of times there are people in the doctor's office who just deal with prior authorization denials, and so if you can get that person helping you out, that can make a big difference too. So like you said, be your own advocate throughout life, and it continues when you're on Medicare.
So let's shift gears a little bit. How do you define aging well?
That's a great question. I think that it is, as I'm aging, as I'm in my late 50s, I think it really is being able to do the things that you want to do and still be able to do that. I mean, I went home during the holidays and saw a lot of friends, and some of my friends who were the happiest were those in their 70s, and they had pretty much retired, but still did some, freelance writing. A lot of us are writers, freelance writing or consulting work in what they love to do, but didn't feel like they had to do it. And they were still, seeing a lot of friends and exercising the way they wanted and just being able to spend the time the way they wanted to. And it was just really interesting to see that group of people seemed a little happier and less stressed out than my friends in the late 50s who have their kids in college and help just, trying to navigate helping their aging parents. It was really motivating to see, maybe 10 years from now, what people who are really happy, what they've been doing and what makes them happy.
And so what are you doing then personally to age well?
Well, I'm trying to exercise more, and my friends are, a group of us are going to an exercise class every morning at 5:45 in the morning. We're very proud of ourselves. and just doing the things that we like to do, but also trying to be less stressed out about everything. And I think just, support from friends and family has been really great, and just really opening up to more friends and family. So many of my friends are my age, and so we're all dealing with exactly the same things, and just being able to talk with all of them about this, I think, is really helpful too.
Yeah, that's one thing in this podcast that we've learned this is our 5th season, and we started out with much more of an exercise science perspective to it because I'm an exercise physiologist. And over this last 4 years, we've really come to understand much more the importance of that social connected piece, that purposeful social connection, and just how much more important that is really than exercise and diet and all these other things. It's who are we hanging out with? What are we doing? What are we doing to be more positive and purposeful in our lives? And that's going to have a much greater impact on us than how much we've exercised or, how many supplements we take or what our current biohacking protocol is and everything else. So kudos to you.
It is really interesting, like the happiness studies, the Harvard happiness study, and how they found that, as a personal finance writer, I was hoping that they were going to find that, financial preparation made all the difference. But the big difference was the connections and, being really intentional about it and being intentional about keeping in touch with people, from a distance. My college roommates and I have tried to make more of a point to keep in touch. And I think that's making us all very happy.
That's been a big benefit of, kind of our generation hijacking Facebook from the younger people. Is that, it's maintaining those social connections. Because I'm closer to friends now from high school than I ever was back in the late 70s when I was going to school with them.
Because it's easier. I have some middle school friends I reconnected with, about 10 years ago, and it's great. I get to see what they're doing, and would have never just thought to randomly reach out, but it was just really great to reconnect with them on Facebook. Now I feel like we're back in touch again.
And we used to lose contact, as soon as that little address book that you were carrying, if you didn't change somebody's address or phone number, you were detached from them if you moved away. Now it's like, I'll just Google them and I'll find them.
I know,
they're on Facebook somewhere or LinkedIn.
Yeah, it's a relief to be able to do that, and just in a non-intimidating way, and making an effort though then to see people when I'm traveling or going back. I have a lot of friends and family in DC, and when I go up there, just trying to see more people, I think is a really, really good thing.
So, what are you looking most forward to in retirement? I mean, you're a ways away from it yet.
Not
but
too far.
Not too far, but I'm closer, but I'm 2 years away from 65, but I never really given much thought on retiring. I want to keep working as much as I can.
It's so nice to be in a job, that you just love doing. I know I'm in no rush to retire, but as a writer, it's just neat to see what my, friends and colleagues have done. And so many of them, retire from, every day, full-time job writing, but are still freelancing. And, one of my friends just, only would take assignments that she really wanted. And this was one of the ones in her 70s. And so she does some articles for the New York Times every once in a while, and that's it. And I think that's just an awesome thing about being in a job where you can do some of that. I have some, a lot of former editors who now are just writing, a few really cool assignments for editors that they really like, and being able to still do that, but also, being able to pull back and spend some more time traveling too.
Do you have any aspirations to kind of move into the fictional writing or?
No, I've never been a fiction writer. Always a nonfiction person. So I think that my dream freelance jobs would be, writing about people's personal finances, which doesn't sound like a dream, but I always love telling real people stories and talking with people about, their situations. I love talking with people about what their retirement looks like, and financially, but also how they've kind of pieced it all together. And I would just love to be able to keep telling stories like that.
One thing I'm loving about doing this podcast is it's taken me beyond my, 28 years of college teaching to really teaching to the masses, but also learning so much more. I mean, being able to really dive into learning the multiple different aspects of aging well, and moving away from just exercise to understanding how do I manage Medicare when I get to be 65. So I'm loving what I'm doing, and I'm hoping that this continues well into my retirement years. So
it's perfect to find that. And it is like journalism and what you do and teaching, you're always learning and you're always meeting new people. And I think that's what makes it exciting. There's never a rut. And you can always keep it up to some point, which is great.
Right. So anything we failed to talk about that you want to make sure that the viewers and listeners hear about the book or about, the work you've been doing?
Well, I think just the key thing is, like you said, just give yourself some extra time before turning 65 and do a little bit of research to make it less intimidating, and then make a few of those key decisions, and then just enjoy it. Make the most of having Medicare, and be happy that you don't have to make a lot of decisions later on. And if you have traditional Medicare, you can go to any doctor you want, which is just, a lot of people haven't had that option, during their working years. So I'd say just, spend a little bit of extra time preparing, and then hopefully you'll feel a lot more comfortable, and then just really be able to make the most of having this coverage.
So where can our viewers and listeners learn more about you, find the book? And I recommend, if you're turning 64, 63 like myself, get the book, start reading it early, planning. If you know somebody that's turning, at any age, get them the book so that they can prepare. But where can they find that book? Yeah.
Well, I have a website. It's KimberlyLankford.com, and you can pre-order the book there. The day it comes out is February 24th, but you can order it anytime. And the Simon & Schuster website, there's also a page for ordering it there. It's called Medicare 101. And then Amazon, Barnes & Noble, all the big major places, you can order it there as well.
It's definitely a great gift to get anybody that needs to learn this information. So, well, I've enjoyed this. I've learned a lot. I don't know if I'm more intimidated or less intimidated. I think I'm probably not intimidated as much as I'm much more, okay, I need to get my act together and start looking into all of this because it's going to be here sooner rather than later. So,
and then you'll feel comfortable.
Yes, then I'll feel more comfortable. And I've looked through the book. I mean, the book should give a lot of comfort to people who are looking forward into it. It's like, it's easy to get that information. And so it's going to at least be a guide for me to find my path to preparing. So I'm excited.
That's what I was hoping. That's great.
Yeah. Well, thank you. I really enjoyed this. Just keep doing what you're doing, keep aging well, and keep helping people age well.
Thank you. This is such a pleasure. This was a wonderful conversation. I really appreciate it.
Thanks. I appreciate it too. Thank you for listening. I hope you enjoyed this episode of the Aging Well podcast. Please like, subscribe, or follow, and share this episode with a friend. And be sure to visit the affiliate links in the description below. Thank you for listening, and until next time, keep aging well.